Well, that's Omaha in the winter. This is another session of our practice calcium therapy. There are these free sessions that we're going to start and tell you how we use these. And I wanted to get to that today as opposed to theories or anything like that or ideas that we've discovered. I sat down and made a list of things that these calcium materials are being used for. And I mean, really, it's just incredible what we've done with them. So I'm just going to run down this list because let's say we start with the Hollenbeck, the instrument that I could never remember the name, and the little bit of calcium material that you start with that we have used for so long, it's just terrific. And then how we use the very good articulating paper with simply a 2x2 sponge to figure out what your bite is doing. Remember, your bite is not supposed to be, no, not that either. It's supposed to be unified, together, articulated intricately in one set of teeth. Another thing, or this happened quite early, was we made a toothbrush. This is my toothbrush, and it's a toothbrush with the calcium on it. Well, what do? You put it in your mouth and brush. And the secret of it is you brush, empty your mouth, and leave the residue. And it works wonders, and people love. We send those all over the place. We've developed a prophylactic paste, when they polish your teeth, with calcium in it, because it's like going all over your mouth and giving you an intense treatment of you're burnishing the calcium into the enamel, and the gums just love it. This is the kind of thing hygienists could use and do a fantastic job. It would help them so much. It takes off stain easier, and it remineralizes the enamel, the ligament, and the bone. You get that calcium in there during that brushing or whenever you use these materials. And you remember the list of things, the properties. It's anti-inflammatory. It's the anti thing. The properties has so many good properties to it. It's used, the calcium is used to figure out diagnosis, which is, wow, is it ever helpful? And one of the first signs that it's working is there's no more blood that comes from your gums when you're brushing your teeth. But in diagnosing, if you put the paste into the mouth, into an area, and if it's healthy, there's no bleeding. In other words, healthy gums. If you put it into the gums between the teeth, while it's a paste for about 4 seconds, and it bleeds, there's infection right there, and that the bite is not correct, and something's aggravating that gum tissue. It's terrific for it. You get people who get chunks of food or popcorn holes caught in their mouth. This is wonderful for getting at those directly. And another thing, when you apply things in the mouth, you'll notice that you don't have to Clean the whole area before you put your medication in, or wish water all over, or put some bug killing, bacteria killing in there. No, you don't even have to clean the debris out because the calcium will take care of that while it's in there, and it just brings things out of just bad things out of there. Uh, it is used as a brushing agent. If you use the Oracal, I'll show you that. You use it as a brushing agent. Here's some other things it can be used for, and we do bad breath. It's terrific for bad breath. Orthodontic braces. You know, kids go to the orthodontist, they get them tightened, and that hurts. That hurts. Well, we've had kids come from the orthodontist where that's hurting, and just putting a little bit of calcium around those braces takes the pain away right away. And in the process, it pushes the effect of the movement of the tooth safer, more safe, and faster. You want to be careful in ortho. You don't push those teeth around too fast. It does that. It calms things down. Cavitations. That's where you have a tooth taken out and the socket is infected. You just put a little bit of this chips into that socket. You don't have to go down and dig out the infected ligament. That is, oh gee, it's terrible. Just put a few of the little particles into the socket a little bit. We had a dentist that we trained in Greece, and people couldn't figure this all out. This cavitation was just killing this woman for weeks and months, and so he told him, try those, put the little, in days, a few days, she was so much better and on the way to healing without trifurcations. That's where you have a big tooth and it's got 3 roots, okay? And right in the middle here is the trifurcation. The rule is that if you get the trifurcation infected, you got to take the tooth out. In the 1960s, we didn't believe that would be necessary, so we tried putting calcium into the trifurcation, and it works like a wonder. You may have to do it 3-4 times over a month, but it heals. It calcifies the trifurcation, keeping it keeping the infection away from going into the nerve and killing the tooth. So we save teeth that have had trifurcation problems. Fistulas, where the tooth is dead up here and it's got a big hole here with the drainage going into your mouth. You can take these particles and tease them into the trifurcation. Now, you don't have to dig out half of the bone in that area. Just tease the chips. Let's see. And yeah, our little Jiffy tubes, remember we called those little Jiffy tubes? We squeeze it in. Use that and squeeze a little of that right into the bone, into the fistula. It'll heal in days. We couldn't believe this. I didn't believe it at all. I sat down in my office and I thought, holy cow, 3 days and that fistula is granulated over and clean. And it wasn't all the way healed, but it was closed. And it was on the way to healing. Let's see. Well, of course, it's good to use the calcium in a root canal, even if it's just a slight bit. Even if it's something, the calcium you can get with your instrument, you can get it clear up to the end of the root and get the little calcium there. That's what the research was all about with the rhesus monkeys. You just get a little bit at the tip. It helps the seal. You got the seal of that root wide open. It helps it close. And so the root canal works better, lasts longer. Here's one. If you have internal resorption on a tooth, there's some recent research within 2 years here that using calcium on that internal resorption where it's eating itself up inside the tooth, internal resorption, if you can get a little calcium in there, either from the outside or the inside of the tooth, it is the only thing that will have any positive effect on internal resorption. It's very much like I just showed you, where the root tip, you get the calcium up at the root tip and it closes. That's the same. What's going on there is the same thing as the internal resorption. And you don't need tons of it up there or digging all the bone out. Get this. Anyone in the family have an appliance like Invisalign or aligners? I just wish orthodontists would listen to us, because the way this calcium works is a positive push to make things heal. Well, why isn't it that we're using the calcium material to help to keep things healthier when braces are in your mouth, or Invisalign? Invisalign, what they're doing is moving the tooth a little bit, moving it a little bit, and it moves it where you want it to go. Well, why not have some calcium there where it actually soothes, calms, takes the pain away, and gives that a little push without a shove. You don't want to shove teeth around with orthodontic appliances. And orthodontists know all of that. It'd be great if you just have a little nudge. And there's a thing called minimal invasive when you're dealing with decay. You remember you might have said, you're so deep you're about to go into the nerve, so you leave just a tiny bit of decay, which to some people is like the end of the world of, the world's going to collapse and go to Mars or something. No, minimalizing tissue so that it's not so invasive, so that the cleaning is what kills the tooth. Leave it, put some calcium there, and it'll work far better. Now, I just want to show you something that I'm doing. The Oracal that we have, you use it in your mouth. You remember my routine? Practicing calcium, take 3. Oh, this might be 4. Take 4. What I've been doing is taking the Oracal and putting it into the mask. And just a few drops, and put the mask on. I'll tell you, right away it made me feel, boy, that feels good. I think I'll wear this mask. You're not fighting it, because it isn't the liquid that's going into your nasal system and down into your mouth. It's the moisture of this Oracal. And boy, I can wear it all day, and if I just dribble a little of that into the mask, it is, excuse me, the mask is, it makes the whole experience of a mask, it's like, oh, that smells good, that feels good, I think I'll wear this all day. And what do you wear it for? You wear it sometimes to save your life, you know that? So uh, think of that. And please, if you can mentally go back and think of the uses of these materials, what does that mean? It means there is research out there. For any dentist that really wants to get into something exciting, I remember I looked in the literature in 1962, and I couldn't find anything about calcium materials and periodontal disease. Nothing in the world written on that subject. And I was really depressed for 2 minutes because I realized, wow, that field of research is wide open. And these things here are the research that we've been doing. And if you want to do some research at your university, oh my, that's hard to do, to get into a university and do some really research. Or you just want to work with some people that are learning things from things that they have never been discussed, had discussion with anybody. This is just dripping with research projects. So thanks for coming. Next time, we're going to talk about the osteoendocystic therapy. Now that's kind of that's the pinnacle of all of this, that topic. So thanks for coming.